More than 390,000 people in South Africa have tested positive for COVID-19. Now, many of them have had mild or no symptoms. Others, of course, have been suffering a variety of effects. Some have now recovered completely. Let's talk about what you can do to treat yourself at home and when you need to get help from a doctor or a hospital. I'm joined now by Dr Roz Rabie, an immunologist and allergist. Good evening, doctor. You know, so many people will get very mild symptoms with COVID-19, and we see that there's been over 229,000 recoveries, so people absolutely are getting better. Is there a way to speed your recovery by boosting your immunity?
Evening, Sally. Thank you for inviting me and having me this evening. I think that a lot of South Africans and a lot of people worldwide enjoy or kind of purport to get better using supplements. And so there's a global market for using supplements. And we know from ancient therapies, so Ayurvedic and Indian medicine and even Chinese medicine, that many of these therapies may work, one being vitamin C, for example. And we now know from updated immune studies that vitamin C is an antioxidant, and it certainly works in shortening the time that you would come a virus. And we also know that it does decrease the risk of developing pneumonia in viral infections.
So vitamin C, definitely a good option. What about vitamin D, which of course is good old-fashioned sunshine? A little bit of that every day, is that recommended?
Absolutely. And the problem with lockdown has been that people have been stuck indoors. And we do know that many South Africans are suffering vitamin D deficiency because we are spending time indoors, stuck to our screens, not just now with lockdown, but I think just in general, you know, kids are spending.
So a little bit of sunshine, a couple of oranges. What about zinc? I'm hearing that people are buying up zinc in great numbers from supermarket and pharmacy shelves. Is zinc a good option?
Yes. So, in fact, all three so the vitamin C and the vitamin D in terms of vitamins and zinc as a mineral, they're all useful in developing the chemicals that are produced by neutrophils, phagocytes, and other important cells in the immune system. And all of those cells work together to decrease the cytokine storm that we hear about in the coronavirus infection, and will decrease the risk of more severe complications. But I think the important thing to know is that it's not going to stop you from getting the virus. That's the important message.
Right.
Any of us can still get the virus.
Sure. So you've really got to look after yourself when you do have the virus, and all these good suggestions. And of course, eating your veggies and eating really, really well. When do you know you should get to a hospital or to a doctor? Because most of us will probably... When do you know you must get to a hospital or a doctor? What are the real warning bells that your home treatments are not getting you through?
So I think, you know, the messages that have come across worldwide are the same. So I think we all know our bodies best. We also, as parents, know our children best. And you need to trust your own body's response, and you as a parent need to look out on your children. So it is the breathing difficulties. I myself as a clinician advise my patients that have COVID-19 to get one of those pulse oximeters to measure the oxygen saturation in your body, and to measure that and see if that oxygen level's decreasing, then you need to be seeking more urgent medical attention. But I think the important thing is the breathing difficulties. And we know with the diabetics that they closely need to monitor their sugar levels. And
oh dear, we seem to have...
needs that
okay.
level is increasing.
Sorry, we're just having
so the diabetics whose sugar levels...
Yes, carry on.
So, for example, the diabetics whose sugar level is going out of control, they need to get help urgently as well. But I think if you are feeling that you are getting worse, whatever your symptoms may be, you need to get medical attention more urgently. And we know that patients are even getting strokes with coronavirus infection. So any unusual symptoms in terms of neurological symptoms, so symptoms that may be mimicking a stroke, you need to actually seek attention. So I think the message for me that I carry across to my patients is you need to watch out for any worsening of any kind. It's not simply just those breathing symptoms. And we're learning more and more about this virus. Things are not as simple as we were initially led to.
All right, we're going to leave it there because we have got a line that's just fading on us. But Dr. Roz Rabie, such excellent advice there. Immunologist and allergist giving us great tips. Zinc, vitamin C, sunshine, vitamin D, all good to help keep us strong. But any sign that you might be worsening or breathing difficulties, do speak to your doctor or get to a hospital.